Hello and welcome to Medical Dialogues Journal Club. I am Dr. Garima and today I am going to talk about a recent review article published in the Fertility Science Research journal published by Scientific Scholar. Dual trigger in IVF is SWOT analysis. The gold standard agent for inducing final oocyte maturation and resumption of meiosis in vitro fertilization has historically been human chorionic gonadotropin, which act as a surrogate for the physiological spontaneous luteinizing hormone surge. Gonadotrophic releasing hormone agonists were introduced as an alternative trigger in gonadotrophic releasing hormone antagonist cycles, specifically with the advantage of a reduced risk of ovarian hyperstimulation syndrome. However, the use of gonadotrophic releasing hormone agonist trigger alone is associated with poor corpus luteum development, causing impaired endometrial receptivity and a reduced chance of successful implantation. Subsequently, a combination of a bolus of gonadotrophic releasing hormone agonist and human chorionic gonadotrophic was proposed to improve IVF cycle outcomes, especially in poor and normo-responder patients. Different studies with significant heterogeneity have reported conflicting data about the effect of this trigger combination on various outcome parameters. The aim of this strength weaknesses opportunities threats analysis was to summarize the currently available evidence regarding the use of dual trigger for final oocyte maturation and trigger in normal and poor responder patients in comparison to the standard human chorionic gonadotropin trigger. Studies were included if they were randomized controlled trials, prospective or retrospective studies, compared HCG trigger and dual trigger and reported at least one of the outcomes of interest: oocyte number of mature eggs, fertilization rates, clinical pregnancy rates, live birth rate, implantation rate, and miscarriage rates. Studies failing to meet these were excluded. Clinical evidence now supports the value of dual trigger where there have been a previous low proportion of mature eggs or where there is a suboptimal LH response to gonadotrophic releasing hormone agonist alone. In poor responders, dual triggers could be considered as an effective first line. Dual trigger allows for comparable outcomes in normal and high responders, allowing the possibility of fresh embryo transfer with good clinical pregnancy and live birth rates while minimizing ovarian hyperstimulation syndrome risk. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.